Danna with the Chesterfield Chamber, and here with me is Dr. Robert Cross, who practices family medicine at PartnerMD here in Midlothian.
Yeah, it's really a model for delivery of medicine that's kind of developed out of a need. If you look at primary care medicine in the last several years, there have been a lot of changes, and that's really affected the relationship between physicians and doctors. Traditionally, a family medicine doctor would probably have a panel of somewhere between 2,500 and up to 3,000 patients, and that really creates challenges in trying to access and serve those patients. So concierge medicine has kind of been an approach to that because there's been a lot of frustration on patients' parts as far as the relationship, the time spent with the patient. So we restrict our panels to no more than 600 patients, and because of that, there's just a lot more time available to the patient to interact with the physician. Physicians are more available to their patients. It just really enhances the relationship quite a bit, and it's really all about time. So usually when we see a patient for the first time, we like to have an introductory visit that may be as many as 60 minutes, or we may schedule a full physical exam, which may be 90 minutes in length. And really the purpose of that is just to get to know the patient. A lot of times people have said if you listen to a patient long enough, they'll tell you what's wrong with them. And that's part of the problem with modern delivery of medicine is we don't have the time to sit and listen. We get a good history from the patient, and then based on that we'll do appropriate lab studies, and then we do a very full and comprehensive physical exam. Our approach, I think, is really holistic. I think we try to look at mind, body, and spirit, and the whole person. And again, the time factor allows us to do that. I think it's really for almost anybody who just wants to have an enhanced relationship with their physician. So concierge medicine sort of started out as something maybe that was more for the professional, the executive who was busy, who wanted to come in, who didn't want to wait in the office for their appointments. Maybe he was traveling and wanted to have access to their physician in a very timely fashion. And we do provide that, and that's great. But it really is for anybody who just wants to have enhanced access and a more personal relationship with their physicians. And I think another service that we provide to our patients is coordination of care. So in this fragmented world of healthcare, we have many specialists who do a great job, but they typically focus on their one little area. And then there's oftentimes not yet a way for all of our different specialists to communicate with each other. So changes get made in medications or different testing, and we need to bring it all together. And so that's really what we provide is sort of the patient home, sort of a repository of all their records. We can talk to specialists oftentimes, and it's nice, again, because of time, I can pick up the phone and talk to a specialist and ask them a question. In a busy traditional practice, doctors just don't have the time to do that.